In this video, we're going to be going through the respiratory system. So starting cranially and working our way caudally, we will first see the larynx, and then inside there we'll see the vocal folds or the vocal cords. We'll also see the trachea, and then the bronchi, which is plural. Singular would be bronchus. Then we'll see the lungs, and you'll need to know how many lobes will you find in the lungs of a cat and how many lobes will you find in the lungs of humans, because those are different numbers. So we will go over that. We'll also identify the diaphragm, and then we'll talk about how does the diaphragm move when we inhale versus how the diaphragm moves when we exhale. So we will go over that as well. The larynx is this cartilaginous structure that contains the vocal folds. If you remember the airspace inside the larynx, that was the glottis that we identified. And then down here is the trachea. It has these rings of cartilage that give it structure. If we look down into the larynx, we can see the vocal folds or the vocal cords. These parallel folds of tissue are sort of really close together, and then when air moves between them, they vibrate, and that's what causes vocalizations. So in the cat, this would be their meowing. And then, so there's the picture of the larynx versus the trachea, and then the vocal folds. You can see a lot better in this picture. If we follow the trachea down, we can see the lungs, which I'm holding right there, and then the bronchi are the tubes that lead from the trachea to the lungs. They are covered here in sort of a connective tissue, and the trachea goes behind the heart, so it's kind of hard to see, and it's actually easier to feel than it is to see it. But if we try to get some of this connective tissue away, we actually see more of the pulmonary arteries and veins, but you can sort of pinch just between the lungs and the trachea behind the heart, and you can feel the bronchus a little better there. Here I have a diagram of the cat's lungs. So as you can see, the bronchi are branches off of the trachea, and then I am numbering the lobes of the cat's lungs. So on the right we have 4 lobes, and then on the left we have 3 lobes. And so the cat has a total of 7 lobes. Compare that to human lungs, where we have 1, 2, 3 lobes on the right and 2 lobes on the left. So 3 lobes on the right and 2 on the left. And then we also have that little notch on the left side, and that's because that is where our heart sits. So it leaves room for the heart. I tried to number it the best I could on this picture, but it wasn't the best picture. But you can see 4 on the right, 3 on the left for the cat. And then down here is the diaphragm. Now the diaphragm is a muscle. It sort of seals off in between the thoracic cavity and the abdominal cavity, and what that seal does is it creates a vacuum when it moves down. So the diaphragm sits right below the lungs, so right there, and when it moves downwards, that creates a rush of air into the lungs, and that is how we inhale. So it's creating that vacuum and pulling air into the lungs. When the diaphragm relaxes and goes back up, that allows our lungs to deflate because it's releasing that vacuum, and that is what allows us to exhale. So down is for inhaling and up is for exhaling. And here we can actually inflate the lungs using a straw. So I cut the straw at an angle because it makes it a little easier to get in between those vocal folds, because you have to go in between the vocal folds to enter the trachea. So that's what we've done here. We've put the straw in between the vocal folds, and we can feel it in the trachea there. And then just make sure that your ribs are not compressing the lungs, because that'll make it really hard to inflate. And then just exhale, don't inhale, exhale into the straw, and then you can inflate the lungs. So the movement is going to be kind of subtle. If you see the stomach inflate, that means you're in the esophagus, so you're in the wrong place. But here we can see a few quick breaths.